This is my student support system. Keep watching, keep learning.
At village level, health services are provided by two link workers. These are ASHA workers and angnanwadi workers. ASHA worker is connected to health department while angnanwadi worker is connected to ICDS scheme. Both workers work in the villages up to the population of 1000. They provide necessary help to ANM and work as a link between health system and community. Anganwadi workers and ASHA workers both are selected from the same community where they work. So they are the person whom people trust. They help ANM in immunization and health related survey in the villages and the areas covered by them. ASHA and Anganwadi workers also help the ANM in national health programs such as Pulse Polio program and registering antenatal mothers, providing antenatal care, postnatal care to the mothers. Anganwadi worker is also concerned with the supplementary nutrition to the pregnant mothers and children.
My student support system. Keep watching, keep learning.